And our third and final speaker in this short, sharp session is Dr. Tim Badgery-Parker, who's a biostatistician and data analyst at the Australian Institute for Health Innovation. He's interested in patient safety and use analysis with big data sets to answer questions important to clinicians. And today we're looking at what is the relationship between patient age and medication error rates. Over to you, Tim.
Thank you. Okay, so the relationship between patient age and medication errors. So just as background, when we were doing the analysis for the main STEP-WEDGE trial, we investigated various factors that we might need to adjust for in the analysis. And one that came out was very significant was patient age. And so we adjusted for age in the analysis. And then later I went back as a secondary analysis to just have a look at what is that association to get a feel for which patients are at greater risk of prescribing errors simply because of their age. And then I also did a similar thing with the medication administration data. So our study population was the paediatric inpatients. As I've mentioned before, oncology was not included and the ICUs were not included. For this analysis, I've just combined all the orders, whether they're made on paper or EMM. I've combined them across both the two hospitals that we looked at and all the years that we've had data for at the time. And so I've adjusted for those factors when I've done modelling, but I'm mostly presenting crude rates today. I'm just looking at the errors per 100 orders for prescribing. And I have done modelling, but mostly the results basically match the crude rates. For administration, I'm looking at the crude percentage. I'm looking at the percentage of administrations with errors, and in this time I will be presenting the model one just because it's simpler and clearer to understand. So this is the answer. What is the association between medication errors and patient age? So in this graph, the vertical axis shows the number of errors, horizontal axis shows the patient age in years, and as you can see, we've got this quite steep increase from newborns up to about age 8 to 10, where it levels off through the teenage years. And as I said, when I did the model adjusting for relevant factors, I got a similar result. It just sort of went up and then levelled out across the teenage years. We also looked at the errors with potential serious harm and found this, again, it increased from birth up to about 8 to 10, levelled out, and then it appears to be going up again from about 16 years, but as you can see, the confidence intervals are quite wide. When I modelled that, I found a simple straight line from 0 up to 18, just a simple increase in error rate with age for the serious potential harm. So I also looked at it using age groups, and this was because we were sort of interested in the very young patients. We found that the actual harm was highest in the younger patients. So in this graph, if you look from about the middle, up on the right-hand side of the graph, you see the increase with age from 1 year up, which matches what we saw in the previous slides. And then the left half of the graph shows the patients under 1 year split up into several age groups. And you can see the suggestion that it goes up from 1 month up to 1 to 3 months and then comes down. But there's actually no significant differences across those age breaks. And you may recall just a few minutes ago, Carla showed her results for paracetamol, where she had a very large rate in the under 1 month, and then it came down. So the difference is probably in what we've included, and that I've included the multiple hospitals, the 2 hospitals in the multiple years, but this is something we're going to have to investigate further. And if you look at the yellow dots down below, that's the serious potential harm. And that's quite steady across the first couple of years. Then it jumps up a bit, and then it has this final jump at around 16 years. So dose errors, as we've heard, are the most common ones and the most common ones associated with harm. So I pulled them out separately, and they showed a similar pattern of increasing and then levelling out for the teenage years, although the levelling out appears to come a couple of years later. And again, you'll see that curve looks as if it's curving down at the end, but very wide confidence intervals, so don't have too much faith in that. Again, looking at those by age group though, we do find this difference in the very young patients. Again, the lowest rate was in those under 1 month, but then there's quite significant jump 1 to 3 months before it comes down again 6 to 12 months to start its increase. So worth exploring further, I think. And with the high serious potential harm, that's got this steady increase over the first 6 months, then it drops and it's flat, and then still we have this big jump at 16 years. So I also looked at the type of dose errors by age group. So in this graph, each bar is the total number of errors, dose errors for that age group. So there's fewer errors in the less than 1 month, more in the higher years, just because of the numbers. Interesting, the orange bars, they're underdoses. And you can see for less than 1 month, more than half the dose errors in that group are underdoses. And then that drops with age to about 3 to 6 months, and then it remains steady at around a third of dose errors are underdose errors. Then at the top, the purple bars are the overdoses. Less than a quarter of dose errors in the youngest age group are overdoses. Then that steadily increases, reaching about 50% in the 12 to 16 year group. So now if we move on to the administration errors. So now I've gone from presenting the crude rates to the adjusted rates because the crude rates were a wiggly line, but this is the real message. We got this steady increase across the age groups, but it's significant statistically, but it's actually very small magnitude. So it's something we need to adjust for, but whether it's actually importance clinically, I'm not sure. When we looked at the serious potential harm, we found this curved shape. So those aged around 8 to 10 had the lowest error rate for administrations, with higher rates for the younger and older patients. But across all the age groups, there's no significant differences between age groups. So this is more suggestive that there is some sort of curvilinear relationship, but we haven't got any statistical evidence of it yet. So I went out to see if I could find what other people had done, and I couldn't find much. A lot of people have used age in their analyses, but not actually giving what is the relationship, and certainly not in a form that can be compared with my results. So I only found these two that were comparable. One important difference, as I said, our study, we did not include the intensive care units, where both of these did. So Koshal et al., they had a large study. It's not as big as ours, but it's fairly substantive. And they just looked at it by age group, and they found the highest rate in neonates, which then dropped to the lowest rate in infants, and then increased steadily up to the adults. In contrast to ours, where we just had low rate in the infants and then increasing over age, levelling out in the teenage years. So that difference with the neonates may be related to the ICU inclusions, but don't know at this stage. And then Takata, they had a smaller study, and they just found a steady increase with age using a trigger tool for adverse drug events. So that was a significant increase. They didn't observe the levelling out that I observed, but they may not have had the sample size to detect something like that. So in summary, the association for prescribing errors is an increase with patient age, levelling out across the teenage years. It's a similar pattern for the more serious errors, with the suggestion that they may increase after age 16. And underdose errors are more common for the very young patients, and overdose become more common over patient age. And administration errors, we appear to have this small but significant increase with age. Thank you.